Can you help me get over my fear?
Actually, fear is a normal thing that you would have prior to surgery. If you didn't have fear, then I would be more concerned because this is a big undergoing that you're going to be doing. It's surgery after all. However, there's going to be a couple things that we're going to go through with our pre-surgery education, and you're going to be doing that with me. So I'm going to actually be going through all of your laboratory results, and I kind of go through them with you because some things that your primary care doctor and you have talked about, you may not know that are a big issue. Okay. So the first thing that we're going to make sure is, just as Dr. Hillock had talked to you about, you went and saw your primary care doctor. Okay, so what I want you to do is you're going to arrive at the hospital at a certain time, designated time. At that point, once you do arrive, we're going to make sure that you're in the pre-op area. Anybody that comes with you, they're more than welcome to stay with you until it's time to take you back to your OR suite. Then what we're going to do is actually talk to you about your anesthesia and how that is going to work. So you're actually going to be meeting a lot of people throughout this whole entire process. There's going to be about 5 people at the hospital that you are going to be meeting. They're all going to be asking you your name, what we're doing for you, what side we're doing for you, your birth date, and any allergies to any medications. So you're actually seen by a whole team there. The surgery time itself, depending on which surgery we're doing, if it's the makoplasty, is still going to be about an hour long. Dr. Hillock's going to come out and talk with family and friends once he's finished. You'll still be back in the OR suite with us, waking up and recovering. Okay? We're going to make sure that you've got functioning of your legs. We're going to make sure that your pain is well controlled, that you're not feeling like you're going to throw up or have any nausea issues. Okay?
I've never had surgery, believe it or not, at my age, but what is it like?
What is the surgery actually like, or what it's going to feel like?
As a patient, do I feel anything?
Actually, right when you go into surgery, you're not going to feel really anything because we do give you some medication that's going to ease your anxiety. The staff there that you're going to meet are very friendly. We're with you the whole entire time. When you do wake up, you won't really feel any pain on that side of the leg because we're going to give you some numbing medication. What you can expect, though, is when you do wake up, you may or may not have a Foley catheter placed in your bladder, depending on how long that surgery lasts. And if we think that you're not going to be getting out of bed that first day, we're going to make things very comfortable for you. We also start you with pain medication right away, so you will feel kind of like you're on vacation with this knee replacement done. However, here's the hardest part, and this is what I tell all of my patients, is the hardest part is you actually doing this program. The first time that you get up out of bed, it's not going to feel like your normal knee. You're actually probably not going to feel it at all, which is why we're going to put you in a large black knee brace. That's going to help you to walk and get up out of bed. Okay, and this is a normal standard protocol, which is why we use that front wheel walker. Okay. After that, though, every single day that you work with us as well as with the physical therapy team, you're going to get stronger. That knee is going to feel normal. Okay. The nice thing is we continue your physical therapy throughout, just not your hospital stay, but also when you go home. Okay, so we're going to have a set team even when you go home or wherever you're staying at. At the hospital, there's going to be a recliner in your room, as well as, you have your hospital bed. I tell all of my patients, just like I'm telling you right now, I don't want you laying in bed. I want you sitting up in your recliner. Everything is wireless. You have your own private room. No set visiting hours. So have people come and visit with you. If you want to bring any of your movies or things like that, you have access to that. This will actually make you feel more like you're at home, recovering normal, get your faculties back with you. Okay? You're going to have a great support staff even when you're in the hospital. At any time you have a question, that's what I'm here for. Is I'm an extension of Dr. Hillock, but I will answer and make sure that everything you need, you're going to get while we get you through this process. After the surgery is completed and you do go back to your home or the inpatient facility or wherever you're staying at, we're going to bring you back here 2 weeks later. We're going to remove all of the staples that you did get during surgery, and then we're also going to be looking at your x-rays so you can see the implant. Even though I know Dr. Hillock went over what it looks like, I'm actually going to show you what it looks like in your own knee.
Oh, cool.
So that way you actually get a visual and you can see what's there. At that point in time, then we probably talk about a little outpatient physical therapy that you're going to be doing, as well as returning back to work.